Good evening again. Today is Thursday, August 17th. This is our 4 p.m. Zoom. I would like to welcome everyone to our class. This is Chapter 11, Evaluation and Management. So what we're going to start off with is a quick review to see what you have reviewed and what you know.
In progress.
I'm going to share my screen with you.
Call for 1, last call for bus 1. All students for 7, bus 7. Last call for 1 and all students for bus 7.
Yes, so a quick review. We're going to do just a quick review to see if you all have been reading those PowerPoint slides and reading your chapters. So I'm going to go ahead. So quick review. Only information documented in the blank, which is 2 codes, may be considered in determining level of service. Anybody would like to answer? Only information documented in the blank, 2 codes, may be considered in determining level of service.
Last call for all buses. Last call for all bus students. Last call for all buses.
Anybody want to give me that answer? This was in the beginning. I'll give you a couple of seconds to review it. Only information documented in the blank may be considered in determining level of service. Nobody wants to answer? So we're going to go on to the next one. The next question. The key components of history, examination, and medical decision-making enable the coder to choose the appropriate, what? 3 words. The key components of history, examination, and medical decision-making enable the coder to choose the appropriate, what? It's 3 words. Excuse me, Ms. Danielle, have you all covered this portion yet? Ms. Danielle, Ms. Washington?
I'm sorry, Ms. Crystal, I was talking and I was muted. Yeah, they should be into this part of key components, history and examination right now.
Okay. The key components of history, examination, and medical decision-making enable the coder to choose the appropriate, what? 3 words.
Level of service.
Anthony, can you, with the baby, can you all mute your phone, please? Thank you.
Level of service.
Does everyone agree? And we're going to get the answers in a few.
Yes.
You agree with that answer? You said level of service?
Yes.
Ma'am.
Okay, we're going to find the answers out in a few. The next one.
History levels, examination levels, medical decision making.
Okay. And we're going to find out all of these answers once we go through these questions to see who had the correct answers. Next, only the blank, which is 2 words, may bill for hospital discharge services. Only the blank may bill for hospital discharge services. 2 words. And this is a review of everything that we have covered thus far. And this information will be on your exam. Next
Attending
one.
physician.
I didn't hear you, Ryan. I'm sorry.
Attending physician.
Okay, just keep that keep that on and we'll check that. The blank, which is 2 words, is the subjective portion of the EM service. The blank is the subjective portion of the EM service.
Patient history.
Okay, make sure you keep that answer. And the last one for our review. While any office staff member may be involved in taking the patient history, the documentation is found by the patient's medical record and is recorded by the who?
Physician.
Okay, so here are the answers. So number 1 was only information documented in the blank may be considered in determining level of service. Number 1's answer is patient record. Only the key components of history, examination, and medical decision-making enable the coder to choose the, oh, I'm sorry, wrong one. Only information documented in the patient record may be considered in determining level of service. You cannot code or document or have a code for anything else if it's not in the patient's record. Next, number 2, the key components of history, examination, and medical decision-making enable the coder to choose the appropriate, which was 3 words,
Level
which
of
was
care.
correct. Remember, yes, Ryan, level of care. That was the correct answer. The next one, only the blank 2 words may bill for hospital discharge services, which was correct, the attending physician. The next one, the blank 2 words is the subjective portion of the EM service. Patient history. The patient history is the subjective portion of the EM service. And then the last one, while any office staff member may be involved in taking the patient history, the documentation is found in the patient's medical record and is recorded by the physician. So remember, you cannot code anything if it's not documented in the patient's record, the patient's medical record. So if you were to do that, that can be considered what?
Fraud.
Fraud. So now we're going to go into contributory factors. There are 3 contributory factors: counseling, coordination of care, and the nature of the presenting problem. Contributory factors are those conditions that help the physician determine the extent of the history, examination, and decision-making, the key components necessary to treat the patient. Contributory factors may or may not be considered in every patient case. So the 3 contributory factors are counseling, coordination of care, and nature of the presenting problem. Those are the 3 contributory factors. Next, we have counseling. Counseling is a service that physicians provide to patients and their families. It involves discussion of diagnostic results, impressions, and recommended diagnostic studies, prognosis, risk and benefits of treatment, instructions for treatment, importance of compliance with treatment, risk factor reduction, and patient and family education. And then the last one, the second one would be coordination of care. So that's a team coming together, working as it's the social worker, the nurse, the physician, outside providers. Coordination of care is everybody coming together to get a care plan in place. Then you would have that nature of presenting problem. What is the diagnosis? What is the nature? What is that patient there for? That would be your nature of presenting problems. Any questions or concerns? Ms. Washington, you would like to add anything? I did this part here, contributory factors, counseling, coordination of care, and nature of presenting problems. Does everyone understand the contributory factors, what it entails?
Yes, ma'am.
Yes, ma'am.
Coordination of care, which is a team of people coming together, practitioners coming together to find out and to work together to be able to assist that patient in any way that's possible, any way possible. So it's just a team. Everybody's working together to figure out how they can help this patient achieve the goal in which they're trying to achieve. And then the nature of the presenting problem. What is going on? What is the nature? What is that presenting problem that caused that patient to be there? Let me stop sharing. Can you hear me, Ms. Washington? Yes, you have anything to add to this? Because I know evaluation is in management is really, really intense. And I know that you're very familiar with the evaluation in management. Is Ms. Brandy on? Brandy, Ms. Guillory, would you have anything you would like to add? Or have you all covered this part in your class yet? So we have a little bit more to cover as far as evaluation and management before we take our exam. This class is coming to an end. We're almost at the end of this module. We will be moving on to the next module within the next week or week and a half. So please make sure that you review all of your PowerPoint slides. Make sure that you're reading through the chapter. Make sure that you're reviewing what it takes and the importance of reading everything in the documentation in the medical record. That's very important. If it wasn't documented, it didn't happen. So just make sure that you understand what's going on and don't try to add stuff without getting permission or an addendum to that medical chart that the physician would have to submit. So please just make sure that everything that you're trying to bill for or coding for is in that patient's record. Any questions, any concerns?
Ma'am.
Pretty good. If you ask me.
I'm sorry, I didn't hear you, Ryan.
I'm good.
No, I was saying we'll be going a little bit deeper into E&M probably next week because we do not come out of this mod until the 30th of August. So we do have one more Thursday prior to that. So we're going to dive a little bit more deeper into evaluation and management on our next lecture for next week. We'll go into the medical complexities just to make sure that everybody has a good understanding of what exactly those are. Have you guys had a chance to look into the MDM? Any confusion about MDM as far as what you're reading in your book about the complexities of the medical decision making for the physician?
Majority of it is kind of self-explanatory.
It is. It is. Yep. It
Yeah,
really
once you read over all of it, it makes a lot more sense.
Yeah, 'cause
Like
we
you
did
said, it's
review
almost
this.
self-explanatory, the different levels and how they build on each other.
Mm-hmm.
Right, because we did review this in our Tuesdays class. We went over the medical decision making and the complexity scales.
Yeah. I know that's one part of MDM that can be kind of confusing to most students, but again, if you read the information in your textbook, it kind of, definitely makes a bit more sense.
So please review your PowerPoint slides. Please read through your chapter. Yes, Ms. Guillory?
I do have one thing to say to my class as far as E&M, your lab tomorrow, y'all will get a lot out of the lab tomorrow. It's actually a video done by somebody else, and she walks you through some scenarios. And I have on there also, the AMA puts out like kind of like a handout, but it's just a sheet of paper, but it helps you figure out which level of complexity you're at, and it gives you the parameters. And I have that attached to the lab with that video. So that will also, you can use that handout as a resource to help y'all out when figuring out which level y'all need to be at. So just be on the lookout for that.
Okay, I see somebody do we have PowerPoint slides to look over? If so, where can we find that? Who was that? Is it Haley?
Was that Haley knock-in?
Yeah, that's your student, Brandy?
Yeah, it is. Hey, Haley, your PowerPoint slides are attached to the assignments that require the PowerPoint slides on there. What I can do because Haley, you're brand new.
And normally our PowerPoint slides are stored in our e-learning system. Being that we're in Google Classroom, we're in a place of kind of displacement where we're not usually in the places where they normally are, our slides, because we're still in Google Classroom right now. Hopefully coming out of Google Classroom shortly, hopefully.
Yes.
Yeah.
Yeah, I attached mine, Brandy, in the stream, and I just
hope
uploaded
so,
the
because
PowerPoint slides.
I get mad confused with Google Classroom.
I find it easier than e-learning myself.
I absolutely hate it.
And I love it. I love it.
I don't have a problem with it. I think it's pretty easy.
I absolutely hate it's easy to maneuver, but I don't know. I'm just used to Brandy, e-learning. As much as we complained about e-learning and the glitches that it had in it, the navigation and the functionality and the way that things are laid out, to me just makes more sense. Google seems to be all over the place. I don't know why. In my mind is
I can see that. I can see that.
But Ms. Washington, I post mine in the stream of Google Classroom. I just uploaded them there, the PowerPoint slides.
yeah. I had some voiceovers for mine, so mine were rolling out with voiceovers.
I can do that for Haley's one of my ones that started on Monday, y'all. She's a brand new student, so she hasn't gone through the assignments where the PowerPoints are listed. So I'll go ahead and attach those for my new students. I will attach those PowerPoint slides in the stream this afternoon, but please do not stress new students because y'all are exempt from the final exam. So that is not something you're gonna have to worry about until we wrap back around in the program, okay?
Let's see, any other questions in the chat? Let's see. Does anyone have any other questions or concerns at this time?
So I have a question completely off the topic of this. If I'm not mistaken, I'm supposed to finish before the graduation date. So how do I go about getting my cap and gown?
When's your finish date, Michelle?
I want to say like end of September, middle of September.
Okay, your graduation ceremony will not be until next year. The
Even if
cutoff
I
date,
finish before.
yeah, the cutoff date for the October graduation was the end of July. If you didn't finish the program before then, your ceremony is going to be next calendar year.
And they're only doing one ceremony a year?
We're not 100% on what they're going to do. At this point, that's the information that they're giving us, is that they're only going to be doing one next year, but we're not 100%. That could change.
Any other questions or concerns? Remember, this is being recorded, and I will send the link to your instructors for them to pass on to you. Any other questions or concerns before we log off for this evening? If not, you all enjoy your evening, stay safe, and we will see you all next week. Enjoy the rest of your evening and enjoy your weekend. Bye-bye.
Bye, guys.
Bye.
Bye.
Have a good evening.